Margaret Jacobson was born April 5th, 1944. First child of Abe and Verna Jacobson, who were Pentecostal missionaries in Barbados. As a child, Margaret loved nothing more than drawing with her pastels, listening to the radio with her brothers, writing in her diaries, playing the accordion and piano in church, and going to the beach. How did this child with such promise become one of Hamilton's longest surviving homeless women? How did she go from top student and Sunday school teacher to a destitute woman who slept in the alleyways and alcoves of this city? These are some of the questions I set out to answer when I wrote my book. Her Name Was Margaret, Life and Death on the Streets.
All right. Hello and welcome, everyone, and thank you for joining us tonight for a very important author talk and discussion. My name is Megan. I am a library assistant and programmer at the Waterloo Public Library, and my pronouns are she, her. It's my pleasure to be your host for the evening. Before we get started, I'd like to offer a brief land acknowledgement. So we acknowledge that the land on which we gather today is the traditional territory of the Haudenosaunee, Anishinaabe, and Neutral people. Waterloo Public Library is situated on the Haldimand Tract, land promised to the Six Nations, which includes 6 miles on each side of the Grand River. We acknowledge the enduring presence of the Indigenous people with whom we share this land today, their achievements and their contributions in the community. To give some context to this acknowledgement, today I'd like to highlight a local Indigenous artist, Luke Swinson. You're seeing a preview of his website and Instagram here. Luke is an illustrator and muralist living in Kitchener. He is Anishinaabe from the Mississaugas of Scugog Island First Nation. His art is modern but shares traditional Indigenous imagery, language, and culture. You can find Luke's art on Instagram at Luke Swinson Art, on his website, lukeswinsonart.com, in the junior nonfiction book Treaty Words by Amy Kraft, or in the street mural on Gockel Street in downtown Kitchener near Victoria Park. With that, I'd like to do a little bit of housekeeping before we get started. It'll be an open and inclusive discussion tonight, so please do ask any questions that you'd like. And I will, without further ado, introduce Denise Davy, the author of Her Name Was Margaret. So Denise is a nationally recognized award-winning journalist and author of Her Name Was Margaret, Life and Death on the Streets. Denise worked at the Hamilton Spectator for 26 years, where she won a National Newspaper Award, was twice honored with Journalist of the Year by the Ontario Newspaper Awards, and received 4 National Journalism Fellowships. Denise's book explores the tragic life of a homeless woman, Margaret Jacobson, and exposes the flawed plans that led to today's homelessness epidemic. Her Name Was Margaret was included in the Toronto Star's must-read books for 2021 and has gone into a 3rd printing. Welcome, Denise.
Thank you so much, Megan. You can hear me okay?
We can hear you.
Excellent. Hello, everybody. Thanks to Megan for organizing tonight. You just did a great job. Very interested in having this opportunity to speak on this important issue, and also really thrilled to be sharing tonight with Sarah and Jesse, and I'm interested in hearing them speak as well. So I probably don't have to tell people that homelessness has taken on a much higher profile since the pandemic hit. That's because more people are sleeping on the streets. We're higher profile. Also we're seeing more factors like job losses and rising housing costs that's pushing people there. So what I've learned in my pretty much 30 years of writing about homelessness is that if someone doesn't have a home, they can't build a life. housing is absolutely key to helping people get back on their feet, and it's key to helping them feel safe and having stability so that they can move forward. Without housing, they have nothing. We really are all impacted by homelessness because it's everywhere. And anyone who's ever walked down the street in almost any city or town across this country, especially larger cities like Toronto, you'll have seen someone panhandling or sleeping on the sidewalk or huddled in a doorway. So my goal in writing Her Name Was Margaret was to tell the life story of one homeless person and tell it in as much detail as possible so we would come to know her intimately and come to care about her as much as I did. And as it turned out, Margaret's story was fascinating, and I was very lucky to be able to access her lengthy medical file. And I'll give you a glimpse of what I was dealing with. If you can see that, the 869 pages of documents there. And I also was able to get her diary from when she was 16 and just copious amounts of pictures that were sent to me by her, photos sent to me by her family. So I was very lucky in that way. They were very generous. And what I think is important to remember is that every person on the streets has a story. And that's why I like to start my talk with a video of Margaret, because it reminds us that she was someone's daughter, she was someone's sister, she was someone's aunt. And that's just like all of the people we probably see on the streets. And to me, I think that to know one person's story just helps to humanize homelessness. And it reminds us that people we see who are unhoused were at one time children like us. They had childhood dreams and they had potential, and they were terribly let down by the system. So I want to tell you about how I met Margaret, because that's where my journey began toward understanding the homelessness crisis. And I hope that it will help move you forward in understanding why there are so many people on the streets and why so many have a mental illness. So as I wrote my book, I met Margaret on a cold winter night while I was on assignment as a reporter at The Spectator at a Hamilton shelter. My goal was quite a simple one. My plan was to just interview as many people as I could and write a story for the next day's paper. As is the case when you work for a daily newspaper, you write about different issues every day. So I just supposed that I would basically spend a day on this and move on, and that absolutely didn't happen. So I arrived at the shelter around 11 p.m. The room was filling up with smoke from all the cigarettes. I looked across the room and saw this woman hunched over one of the rickety wooden benches. She had terribly matted hair and gray leathery skin, and she was so worn down that I wrote in my book she looked like an inmate from a Victorian workhouse. I thought for sure she must have been in her 70s, and I was absolutely shocked to find out that she was only 49. And this picture was actually taken from that night there. I'd been covering social issues a long time. I'd interviewed a lot of people in very difficult, tragic situations, but in all of my travels, I'd never seen anyone like her. There were years of neglect and pain etched into her tired, worn face, and I absolutely had to find out what had happened. The question that kept swirling in my mind was, I'm sure the same one that all of you have had in your minds as well, is when you see someone, you just think, how did they get there? And also, how could anyone fall into this terrible state in a country like Canada, where we're supposed to look after our most vulnerable? So a staffer told me that her name was Margaret, and she actually warned me against speaking to her because she could be violent. She apparently had a tendency to hit people over the heads with their hard coffee cups. I absolutely had to find out her story, and I felt like if I didn't hurt her, she wasn't going to hurt me. So I felt quite safe approaching her. So when I did sit down and she allowed me to talk to her, I was as surprised as anyone that she opened up and told me her story. She told me about being born in Barbados, where her parents were Canadian Pentecostal missionaries, that she taught Sunday school classes, she played the accordion, she'd even worked as a typist. She never once looked at me. I noticed that when she spoke, and her cigarette was always close by. And whenever I asked her about her stay in the hospital, that's when she totally shut down. Staff had told me that she'd been coming to the shelter for more than a decade. And as I soon found out, her journey to becoming one of Hamilton's homeless was a long and torturous one. And when I say I soon found out, I mean when I got access to her files, because they were just so detailed and complex. So what I learned was that Margaret was actually one of the longest surviving homeless women in Hamilton. And she'd somehow survived all of those years, more than a decade of living on the streets through the distorted lens of schizophrenia. I needed to find out what had happened to her between her teen years when she taught Sunday school and now. And so I called the hospital and they allowed me these files. And like I said, there were medical notes from doctors, nurses, and social workers, test results, letters from her family, long, long lists of medications she was on. All of it combined, along with many interviews from people to help me pull together her story. So what I knew was that Margaret had gone into the hospital as a young girl. And as I said to the video, she loved to write in her diary, perm her hair, draw pictures with her pastels. But then 24 years later, she'd come out of that hospital so much sicker, which is the opposite of what we expect from our healthcare system. You go to the hospital to get better. The answer to what had happened to her and why she didn't get better was found in one word: deinstitutionalization, which was the emptying of psychiatric hospital beds. So this was a move that began in the 1960s, and it was completely made possible by the introduction of drugs that for the first time helped control many of the symptoms of mental illnesses like schizophrenia. It was actually an amazing invention, and it was lauded by many people. And for many people, it did give them a new chance at life. And so it wasn't a bad move to start moving people into the community. And lots of studies showed they could be more productive, even find jobs. The problem was that the services and the mental health clinics never materialized, and the support staff and the outreach workers and social workers were never hired, like literally nothing. So patients like Margaret, who had relied on 24/7 care in the hospital, like round the clock, 3 meals a day, a safe environment pretty much with her bed, for people like Margaret. And really, this was the shock to me, is when I realized this wasn't just about Margaret's life. This was about tens of thousands of people that had all been impacted by these bed closures, who had systematically been removed from hospitals, away from their safe environments, and into these rundown boarding homes that were completely unregulated. What that meant for Margaret was that she was basically given a bus ticket. Nobody was monitoring her in this home, and told to come up to the hospital every once a week or every 2 weeks to get her injection for the mental illness. And she just couldn't manage on her own. She had the great misfortune to be admitted to the hospital in 1961, in which she was only 19. And deinstitution, unfortunately, was in full swing. So at the age of 21 was when she was first put into the first boarding home, and it did not go well. I wrote in my book, she quickly went off her medication. She'd spiraled downward into free fall. And every time they discharged her, she eventually ended up on the streets. So she'd be taken back to the hospital weeks or months later, often by ambulance, covered in bruises and cuts, her head filled with lice, and at times she was in a completely catatonic state. So the mystery to me, and what really shocked me the most in reading her files, was that the doctors would say it's completely clear this person cannot live on her own in the community. She should never be discharged again. Within weeks, sometimes, the same doctor, the push was so strong to close beds, the same doctor would be saying, we're discharging this person and she should be fine. That's how strong that the movement was to close the beds. In the US, there were brutal stories of hospitals renting Greyhound buses, loading them up with patients and driving them to another city where they were literally let out on the streets. I wouldn't have thought that was true. It sounded like an urban legend to me, but I did find a class action lawsuit that had been actually launched by family members. And so it actually was true. And of course, I mean, I remember working at the SPEC, stories of them loading people up in Toronto on buses and sending them to Hamilton. So I'm going to just read 2 paragraphs from one of the really difficult discharges that Margaret had been through. It was March 23rd, and she was found in the basement of an apartment building, lying in feces and covered in lice. She'd been eating garbage out of the dumpster when the superintendent noticed her and called police, who took her to the HBH. Margaret was in a wretched state, filthy, malnourished, and severely withdrawn. The report stated, 39-year-old disheveled lady brought in by police. Police had been called by the superintendent to have her removed from the locker rooms. From their understanding, she'd been living on and off there for 3 months. The smell was quite intense as feces was everywhere. She was not talkative, has been feeding herself garbage, not very verbal. That was from the police report. And she actually told doctors later that she'd been living there on and off for 2 years. So like I said, despite the horrible condition Margaret was in when she came back to the hospital, doctors just continued sending her back out into these rundown boarding homes. And it was all of these moves were happening across Canada. And they created basically a new subculture of homeless mentally ill people who are still on our streets today because it's still happening. So one of the social workers who worked at the hospital when Margaret was there told me that once the patients left the hospital, they were completely forgotten. And this is another thing that's absolutely appalling, is that there was no follow-up done on patients once they left, which is just really unbelievable. So over the 24 years Margaret had been at the HPH, she was discharged more than 9 times, and she was basically stuck in what staff call the revolving door of just coming in and out. She finally decided she'd had enough after all those years of countless electroshock treatments, of being treated so poorly, of just countless medications. She turned her back on all forms of institutional care. She took to the streets, she slept in shelters, she ate at hot meal programs and church services. The agencies came to know her so well, they called her Princess Margaret. And even police had a nickname for her because she'd often get herself arrested just to buy herself a warm bed. And they used to call her Maggie J. So over the years in which deinstitutionalization unfolded, some 80% of psychiatric hospital beds in Canada were closed. It didn't help that at the same time, the government started making drastic cuts to affordable and supportive housing. And so these two issues combined really created the crisis we see on our streets today. And it's why some 70% of homeless people have a mental illness. There are simply no services for these people. And that's why in so many ways, the dismantling of our mental health system was a government created problem. Today, it's estimated on any given night in Canada, more than 35,000 people are sleeping in our parks, alleys, alcoves, cardboard boxes in cemeteries, and the lucky ones make it into shelters. They are so visible, yet so forgotten. I felt compelled to write my book because I wanted people to understand the backdrop of how homelessness epidemic was created, and also to tell people that homelessness is not a choice. It was created, like I said, by the government's failure to follow through on a plan to provide supports in the community. And it led to what we see today, which is people spilling onto our parks and sidewalks and cemeteries because they have nowhere else to go. So it's basically been 60 years since the mental health system was dismantled, because it started in the 60s, and that mental health services and housing were promised and they still aren't there. It's what led to the popping up of all these tent encampments in cities across Canada, most of which, if not all, were systematically torn down, which I find so cruel, because the pandemic also forced the closure of so many public spaces like our libraries, and they were often the only place that homeless people could find shelter. So one of the myths that I really want to address is that homeless people reject shelters, so there's really nothing else that we can do to help them, that they won't go into them, then that's their problem. But the reality is they actually turn their backs on shelters for some pretty solid reasons, one of which is fear of diseases. And that was very much heightened due to the pandemic. I read a Toronto study that showed people are 7 times at higher risk going into shelters to catching COVID than non-homeless people. You know what? Some of them have a lot of like bed bugs. Sometimes the people would line up at shelters for so long to be turned away that they just gave up. That's a particular problem for homeless women, especially in Hamilton. They may have been a victim of violence at the shelter, which again is especially true if they're a woman. Maybe they have a precious pet, which is the only thing keeping their anxiety at bay. But another myth is that there are adequate beds and service for the homeless. And in fact, agencies are often just barely managing the problem on shoestring budgets and just hanging on with the help of armies of volunteers. I know in Hamilton, there have been some positive changes. We've had Cathedral Boys School is being turned into a shelter. It's supposed to be temporary, but they're hoping it would be permanent. However, at this point, there are still people sleeping outside. Another myth is that a person who has a drug or alcohol addiction needs to just get clean before they find housing. Well, this is an old school attitude. It's actually still persisted among some people. But there are many who still think homeless people are just lazy and just need to pull up their socks. There's just like no compassion. The reality is most homeless people, and this is one of the statistics that really shocked me, suffer from very complex, long-standing health illnesses, both physical and mental. And there's seriously high rates of illnesses like epilepsy, diabetes, and even level 4 cancers. In fact, Margaret had breast cancer, which she refused to get treatment for. And many live under the shadow of addiction and mental illness, and they self-medicate in order to deal with the symptoms. They need stable housing to address those issues. And we are finally realizing this needs to happen and that it's not the other way around. I think one of the most disturbing statistics I came across in my research was the average age of death for homeless people in Canada is 39. That's less than half the average death rate for the general population. However, another shocking thing, most cities do not count homeless deaths. I was writing a story about how in about 30 seconds, you could find out how many people died by a car crash or swimming or skateboarding or skiing or any of those accidents. But we don't know how many people are dying because of homelessness. I find it just absolutely appalling. Toronto started to do it many years ago and they've led the way on it, and they actually could offer a template to other cities on how they could set it up. But as it stands right now, most cities like Hamilton, the only records they have of homeless deaths are memorial walls that agencies have set up themselves. So I think one of the most damaging myths about homelessness is that there's no solution. And in reality, we know how to end homelessness. It's not a problem without a solution. Cities like Medicine Hat, Alberta have actually shown it can be done. And in 2008, Medicine Hat set a goal to eliminate homelessness within 5 years. And they did it by creating a Housing First program that includes supports that are tailored to the individual needs. And they succeeded even sooner than they'd planned. And a key reason was that they recognized the importance of early intervention. They knew the longer someone, and this is true of Margaret, was on the street, the harder they were to reach. They also recognized that it costs between $60,000 and $100,000 to keep people on the street for 1 year. When I first heard that statistic, I thought I got to dig deeper on this, and I found 10 to 15 studies that back that up that had been done in cities across Canada. It's very, very expensive to keep people on the street, and nationally, it's costing about $7 billion a year. And housing that same person could cost about $24,000. So from just strictly an economic viewpoint, there's sure a lot of reasons to start working in and figuring out how to do this. London has ended veteran homelessness. Finland has almost solved the country's entire homelessness problem, and the same way as Medicine Hat, just tailoring individual needs to fit the person. But here's the thing, before anything can change, there needs to be the political will. We need leaders in place who will step up and do something, because the reality is that the current homelessness crisis is a result of decades of neglect, and it will only end when our leaders make a commitment to just stop it altogether. And that's why we need to tell our politicians, stop applying Band-Aid solutions to a problem that has workable and permanent solutions. And like I said, if we don't act for humane reasons, then let's do it for economic, because it's costing us a lot of money. And just, on the selfish side, what about the issue of that we've lost our parks and libraries? So this is not a problem without a solution. And this is why it's so important to reach out to your politicians. And other things you can do, donate your time and resources to shelters. Definitely, they'll call your local, provincial, and federal politicians and demand change, because it's really only when they see a national groundswell, there's votes, they want your votes. It's only then that things really will change. 4.5 years ago, I started a program called Purses for Margaret. And I collect gently used purses and toiletries, and I deliver them to a Hamilton shelter called Mary's Place. In the first 6 months of the program, there were over 2,000 purses donated. And so it's been a huge success. And honestly, it warms my heart, because the reality is it shows that people do care about homeless people. And I've also been told by staff that the women not only appreciate the purses, but they appreciate that someone has gone to the trouble of actually donating them, because it tells them that they haven't been forgotten. So 2 years after I met Margaret, she died a lonely death after hitting her head in a Subway shop. And she was buried in a pauper's grave in a cemetery in Hamilton. And that was a goal of mine, to write a story about it and to write this book, because I didn't want her to be forgotten. It can be easy to forget when we see homeless people that they are individuals. They feel the indignity of being homeless every time a person walks by them and ignores them. They feel the humiliation every time someone fails to look them in the eye. And we have to remember, Margaret had a life before she became homeless and before her mental illness took her down. And while she was on the street, she fought back hunger, assaults, the cold, and like I said, the humiliation. And even though her illness actually was complex, it could have been managed with proper supports. And in fact, when she was in the hospital, the medication she was on, because it was on long-term basis and she had stable housing, she actually evened out and did quite well. So I do believe that the right supports had been in place, that she actually would still be alive today. Instead, her physical and mental health was so worn down that the night I met her, she looked like she was near death. And what I have to remember and ask you to remember too, is that her story is the story of thousands of others who've been forced to endure horrific challenges trying to stay alive on our streets. One thing about Margaret, and everyone who ever met her says the same thing, is that she had this rough exterior and she could be tough, but she was actually very charming, and she was funny, and she was kind. She was really just a gentle soul trying to get by. She had a life before she became homeless. And like I said, she was someone's daughter, sister. And for those who read the book, you know that she was also someone's mother. So just in closing, I wanted to mention that I called my book Her Name Was Margaret to remind people that every homeless person does have a name, and they were taken down by illness or by life's circumstances, often combined with the severe trauma that happened in their life. And I wrote my book to honor Margaret's memory and to ensure that her story won't be forgotten. But it's also a call for compassion and a voice that says her name was Margaret, and we'll remember her, just like we should be remembering all the people that live on the streets. So I thank you so much for listening. I'm very interested in hearing your questions and comments at the end, and interested in hearing from Sarah and Jesse. Thank you again.
Thank you very much, Denise. It was great to read your book, but also to hear you speak about it. And I hope this inspires some of our community members watching tonight to grab a copy. You can borrow it from the library or purchase it from a local bookseller, and kind of put yourself in someone else's shoes to understand a little bit more behind their story. So I'm going to introduce our other two panelists tonight. They are both outreach workers in the region, and they will be sharing some information about homelessness in Waterloo Region. So we have Sara Escobar and Jesse Burt. Jesse Burt is an outreach and harm reduction worker for the AIDS Committee of Cambridge, Kitchener, Waterloo, and area. Jesse has experience working directly with people who use drugs and are experiencing homelessness in various settings, including shelters, drop-ins, and encampments. Jesse's focus is on outreach, drug policy, and safe supply. Sara Escobar has been in social justice work for 25 years and has been fortunate to have worked for local agencies such as One Roof, Extend a Family, Safe Haven, the Working Center, and most recently House of Friendship. Sara is also a co-founder of Peregrine Outreach Waterloo Region, which is a network of care for the street-involved population and the workers that support them. Welcome, Jesse and Sara.
Thanks for having us.
I guess I'll start. And I think the first thing we want to say is that we're really excited to have the turnout that we're having right now. This is an important topic, not only because people are suffering, but I think it's also really important that the community is acknowledging and is allowing themselves to see this issue as a health issue, and they're allowing themselves to lead with their heart. not just with their brains and pockets. And so appreciate everybody that has shown up tonight to be able to just hear about our community and how much a community that we all love very dear, and that we can all do a lot better to support. Jesse?
Yeah, we just wanted to, Sarah and I really wanted to just thank Denise so much for this book. I, as a worker reading it, was very validated. A few tears were shed, knowing that like this, if you haven't read the book or I highly encourage you. That wasn't a promotional plug for Denise, but honestly, please go out and get it, because there's nothing that we're going to be able to say in this short little 10 minutes that this book won't say like 100 times better. So please read it if you're really interested in being part of the solution. Please, take the time to read that, because it was honestly validating for me, because there's so many people that I was picturing the whole time reading this book. Like this is not a Hamilton problem. This is across Canada, and there's not just one Margaret out there. Sarah and I, and I believe a bunch of other workers who are on this call know a lot of Margarets. And so I just wanted to like express that this cycle that we're seeing and that you read in this book is the same cycle we see here, where people are just kind of going through the same shelters, hospitals, and jails over and over and over again, and back on the streets. And it's just the cycle that people are in. And it's really because of the deinstitutionalization of all of our psych hospitals. Sarah and I can go on about stories that we know of people who,
And Jesse, if you don't mind me jumping in quick, I have to actually admit, I have to confess that I couldn't finish the book. I tried more than a handful of times to sit and finish it, and I couldn't. So that's a huge compliment to Denise, because, and we were sharing with her at the beginning of this, that she did a really great job at being able to portray the humanity and the realness that she was in the folks that she was meeting that night. And she did it in a respectful way, and in a way that was obviously thoughtful, which I think that a lot of the times we leave behind. We get lazy with our language. We want to spit out things so quickly that we leave words back, we leave words behind. And those are really important words that we need to use so that we can actually create a whole picture of who that human is. Because there's actually some way that we can connect with each other. There's always a way that we can connect with each other.
We are in a supportive housing crisis. This little picture in front of you is just kind of represents sort of the gentrification that's happening in our region. We have one of our emergency shelters, the only women's shelter, and it's standing beside a condo building that a few people have pointed out who those new condos for, and will they be affordable? Will they be supportive of the shelter that's beside them, the neighborhood that they're moving into? So Sarah and I like to ask very challenging questions. So I wanted just to give a general, brief, really flyby description of what Waterloo Region is currently facing, just so people who are on the call who this is their first, they don't know much about homelessness. Here's just a very quick breakdown. We have shelters. There's about 377 beds that was last counted. That fluctuates a little bit, but only 14% of those are for women. And if you read anything about the Margaret story, that is quite a low number. And those are the two pictures, the two types of shelters that we currently can offer people. And it's not, which again comes with a lot of problems. But in terms of, we only have 377 shelter beds, but currently we have over 1,000 people experiencing homelessness. So over 400 people are sleeping outside of the shelter system. And so that is massive. I kind of have the one picture on the side is just a picture I took when I was doing encampment outreach. I was kind of heartbroken. I knew this individual and they had put up this little Halloween sign. But I think they were really trying to express that they needed help, and that this was not an individual problem. This is not a moral failure. This is a system that we're dealing with that is very broken. like Margaret said, 70% of people who are kind of out on the streets are sort of challenged with mental health issues. And to cope with that and the immense stress that comes with homelessness, the same percentage uses substances to self-medicate their own physical health, their mental health. And so the problem is quite large. We have about, I think I talked to a housing worker recently, and they said they're getting close to 10,000 people who are on the waiting list for subsidized housing. And so that's a lot. Our region, like I remember working at a shelter before COVID hit, and it was over the winter time, and we were turning away 30, 35 people every single night. We had a waiting list, and we just had to keep turning people away. Every single night, 30 people back out into the cold, and it was awful. And people were being discharged from jails and from hospitals with the shelter's name written down as their discharge location, but they would show up and we would just be like, sorry, we don't have a bed here. So they're essentially, we're just discharging people back into homelessness outside of hospitals, outside of our jails. So this is not a Hamilton problem. This is a Waterloo Region problem. And I do believe that shelters have become, like Denise said, sort of surrogate mental health hospitals. The amount that this purely just costs our system, just to be constantly reacting and putting band-aids on downstream services. This is a typical image that I took at a shelter that I worked at, and this is not, if you drive by any of the shelters, this is not out of the norm to see. Their staff are thrown into these really unique situations where we have no sort of training in psychiatric care. I was talking to one of our nurse friends that Sarah and I have. She used to be a nurse at London Psych Hospital, and she said, like, yeah, I was a nurse there for many years, but now I'm a nurse for our street folks and our shelters, and I'm seeing way more psychiatric needs here on the streets than I ever did in the hospital. And yet we are hugely underfunded and under-resourced to handle it, and which results in, sadly, a lot of deaths. Anyone on the call that works any sort of outreach or support role might know these two individuals. I debated about showing their picture tonight, but I thought it was important. One of these individuals was known in the community as Happy Feet, similar to Margaret, where he had leg tremors, and he just died a few days ago at a shelter just down the road. Yeah.
And this is part of the reality, right? Is that we are not talking about just strangers out on the street who are living whatever it is that you and I disagree with, whether it's their drug use, whether it was decisions that they made when they were younger, whatever it might be. The fact of the matter now is that group of people are being affected, but now we are also affecting young people that want to come in and do this amazing work. They want to come in and love this community. They have so much talent, so much knowledge, so much information. And we are just now allowing them to walk into workspaces where we know for a fact they will be harmed day in and day out because they are truly loving and connecting with the people they're supporting. And now we are watching them die. If you cannot connect with the folks that are struggling and living on the streets, then let us connect with the young folks that are coming in and doing that work and who are hurting. They are seriously hurting. We are traumatizing not only one group of folks, the folks living on the streets, but we are also traumatizing the young folks coming in, trying to do this work and trying to do the best that they can. We really have to act. We have to be brave enough to allow ourselves to come in and see this issue from a new perspective, where we can leave our egos aside, where we can come in and just find new solutions. This isn't about blaming anymore. As you can see, Denise has done an amazing job at actually chronicalizing and just putting down what the system, the non-existing system that we are trying to work within.
Which brings me to a point that Denise, thank you for bringing it up. Waterloo Region is one of the regions that isn't tracking homeless deaths, and so Sarah and I will be the first ones to identify that as a huge barrier, and that I would hope would change soon. But we don't track homeless deaths, and so we don't even know how big or broad this problem is, and we have started tracking. And another reason that a lot, like disproportionately, our folks are dying, and I'll just do a little plug based on the picture that you see here, is that people are also dying from failed drug policies. Right now, again, people are self-medicating their mental health using an unregulated drug market. That is why we have an overdose crisis. In our region, we're having over 4 overdoses a day, which when we first finally started counting just the overdose deaths, not just homelessness deaths, but overdose deaths, back in 2017, since we've been tracking that, in our region, we've had 416 people die from something that's very preventable. And Sarah, Sarah's alluded to it. Sorry for me breaking down there for a bit there, but there's a lot of amazing workers out there. I know them, and studies have shown that honestly, like about 33% of emergency shelter workers are experiencing some form of PTSD. I know one worker that had found someone that had died in a supportive housing unit, and no one knew until there's a complaint of a rotten smell. And these are the same workers that have to advocate for change, because there's seemingly a lack of political willingness, and that's usually to do with a lack of sort of public acknowledgement or awareness of the problem. And so I thank Denise again for writing this book. We know the problem, and we know the solutions. So at this point, it's just that we're waiting on decision makers.
Yeah, the decision makers, and we need to be brave enough to ask the hard questions as well, right? So challenge the perspective and the popular narrative right now. So people don't become hardened on the streets. People live through trauma, and they become, and then they're hurt and damaged by that. Pain can cause all sorts of problematic behaviors in all different places. So I think challenging language wherever you are, expand the language. So it's not a bum, it's not a street person, it's a person who is experiencing homelessness. Allow yourself the privilege to just use the language that you have to describe a human. And talk to your politicians. Yeah, Jesse's really good at that.
Right. No, I don't know about that. But honestly, please reach out to Sarah and I. Get informed. Join some of these advocacy groups. Denise kind of mentioned it right at the end of the book that some of obviously volunteer your time and your money if you can to some of these amazing organizations that work. But it does feel like we do too many Band-Aid solutions, and the real change is going to happen at the advocacy level. And so find a group and join. If you don't know of any groups, please reach out to Sarah and I, and we'll be happy to connect you with one that you're passionate about, and issues that you're passionate about. And I would like to just end it by saying, love your neighbor. That includes people on the streets, but also anyone, your family members, your friends. Honestly, it's the support of the people in your life that really matter. And so, and anyways, I'm going to stop there.
I don't know if you want to jump into the Q&A a little.
We can definitely.
I want to answer. Oh, sorry.
Go ahead. I just wanted to thank you both, Sarah and Jesse, for sharing your time and sharing some very personal and raw experiences. I know that your job is hard and you do it every day. And Sarah, you've done it for 25 years. So that speaks to something. please, folks, if you do have questions, pop them in the Q&A. We are starting to see some here. Is there a particular one you wanted to answer, Sarah?
Sorry, are the supervised drug sites not helping with the overdose problem? So that's actually a really good question, only because I think we are really excited about the solutions and new ideas that are coming out. And this is really hard to say, and it's harder to hear, I think, as part of a community that is holding hope. These are all Band-Aids. These are all Band-Aids in a system that was never designed to actually benefit and support the folks that it's supposed to be supporting. And so if we continue to just try, I mean, yes, the CTS side is absolutely helping with overdose, preventing accidental overdose deaths. However, the poison drug supply that we know is existing out on the streets is actually the issue, right? So we need to be able to be brave enough to allow our lawmakers to explore different solutions for that at that level. We can create all kinds of programs. We can sit here and name 1,000,001 ideas that are working everywhere else, but there's going to be people continuously being fed into a system that is broken. There are people being hurt, right? So we're trying to get everybody to think upstream. So think the school system, think prenatal vitamins for a woman that is pregnant, for a young mom, right? What supports is she going to have so that that baby can actually benefit from the support that she's getting, right? So we have to actually start thinking bigger picture. This isn't one person's fault. This isn't one city that went wrong. It's not one politician's fault. And so we have to start thinking bigger picture. We just have to be brave enough to do that. Or else Jesse and I and the rest of the outreach workers, we can all think of great programs that people need right now. But that doesn't change the wave of folks that we know are coming, which is what's contributing to the pain that we live with every day. We know that the system is continuously feeding people in pain, people that are hurt. And we don't have proper supports for them as it exists right now. We don't even have enough shelter beds. That's hard. As a frontline worker, that's hard.
Can I answer the question? Why do you think Margaret trusted me? Because I think it speaks to a wider issue. And I know what she's referring to when I got to the shelter and like she'd been going to that shelter for almost 10 years and nobody knew her story. And they said, I think she'd been diagnosed with schizophrenia because there were violent, or her behavior was erratic. And also they figured that she'd been at the HPH, but they knew nothing beyond that. And yet she told me her whole story. And I really thought about that a lot. And I think it's because I didn't come at her with a survival question. It wasn't, are you hungry? Are you cold? Are you sleeping somewhere? Were you hurt? Or it wasn't all important questions that need to be asked every day because we need to be looking after these people. But I just treated her like I just said, tell me your story. Who are you and where were you born? And I think she loved it. I think she had, I say this in the book, that I think that she felt respected and that I couldn't keep up. Like my pen was just flying across the thing as she just went on and on about, and people afterwards, the staffer said like, wow, I've never seen her talk so much. And I know I noticed somebody mentioned Out of the Cold, and I volunteered there a few times. And one of the things I felt was frustration because you're running to give meals to hundreds of people back and forth the whole night and then cleaning up. And I felt like so many times I would deliver that meal and the person looked at me with this look like, can you sit down and talk to me? I'm lonely. I haven't talked to anybody all day. Homelessness is very isolating. And, I think for Margaret, that's why I wanted to answer that question, was that she trusted me and told me her story, I think, because I just asked her who she was.
Thank you, Denise.
I just wanted to affirm that, when I read about Scott, everyone read about Scott in the book, he's a social worker. You talked about, would issues be better dealt with if we just train people better on mental health issues? Absolutely. I'm all for more training, more education, 100%. So there's definitely that, like that, but like, yeah, Scott drove me nuts the whole time reading every single part
too.
about him. I hope that people that don't read the book be like, oh, those are all social workers and outreach workers are like that.
No.
I hope not, but like,
No.
but like, honestly, like it's one of those things where, yes, better training, I'm always all for, but I don't think that gets at the fact that we just don't have supervised 24/7 supportive housing for people, like ready, available when it's needed. Like that is a structural issue, a system issue. Just getting everyone to like be nicer is not going to resolve someone's homelessness. And so, yeah, that's my like short answer is like, I definitely think more training is like needed, but like all and like we should really put money into things that will inevitably be like, don't need hospitals and therefore don't need police and don't need social workers as much. That's the kind of the situation we're in.
Add something quick to that little bit, because the training is amazing. The training is great. One of the things that we really have to be careful is that we are medicalizing this a little too much. People need human touch. People need human connections. That's simple. It's just that simple. They need somebody to sit with them and just allow them the gift of time and company while somebody sips on a cup of coffee. So as much as there can be training with the mental health pieces, addictions, brain trauma, acquired brain trauma, right? All of those things, learning disabilities, the list can go on. If we forget how to connect with each other as humans, you won't get to that place. So we really have to learn how to not be scared of each other. Allow that love to lead what you're doing. Use your brain. We do it all the time. You sit on a bus and you judge whether or not you're going to talk to somebody. It is the same thing. It's the same thing.
Sort of on the same level. There's actually a question in the chat. I always do that too. I put my questions in the chat, and it's what do you suggest? Where did it go here? When we pass somebody by, someone who's homeless and asking for money, what's the best thing to do? Give money, ? Food ? And I wrote back that the last chapter of my book, I talked to Reverend Bill McKinnon, who's worked with homeless people for about 30 years. And he had just some great comments. He's like, first off, yes, I give it all the time. He said like, he gives all the time, and he's always make sure he has spare change or a $5 bill, whatever. And it's very important to look them in the eye. If you feel comfortable, ask them their name. But he said, like, don't give them $5 and say, don't spend it on a bottle of booze. Like he said, would you do that if you gave a gift card or $5 to your friend or an aunt? You wouldn't tell them how to spend it. This is a gift that you're gifting to someone. You're giving this gift to I just thought that was so insightful because I've heard so many people say that. Well, I'd like to give them money, but I don't want them running down the LCBO after. And I'm like, you know what? Maybe they need that. Maybe that's up to them. They're still, dignified people. If you give them $5 or whatever, they have a right to spend it the way they are. And also Bill said, like, do not offer them like a half sub sandwich or hamburger with a bite out of it, or even a full sandwich, because they might not like tuna or roast beef, or don't offer to take them for dinner or anything. It's like, yeah, give change when you can, or some people give gift cards to Tim Hortons and things like that if they feel uncomfortable giving change. But yeah, I think it's a really good point. Thanks for asking that.
So we are going to keep trying to answer questions because we still have a lot of them. So don't worry, we're not going anywhere. If there are viewers that need to leave, that's okay. We are going to have a recording of this up on YouTube eventually. Let's jump to another question. Maybe can you reflect on some of the regional efforts like a better tent city?
How can you get politicians more invested in homeless problems? And then someone else asked, like, what do we need to achieve? Something like safe supply. So essentially like better drug policy. And then how do we get to regional efforts? Like, how do we get more stuff like a better tent city, or like kind of lumping them all together, just mean like, you are asking all the right questions. That is something that I think groups all over the place have struggled to answer because they're trying their best to get their voices heard and get the public aware. So honestly, like I don't think there's an easy answer to that one. Any of those. We want people, like the general public, to be aware of sort of the policies that we're asking to change and the things that we're asking to change. Like the example of safe supply. Sort of, I was talking to Denise earlier about how frustrated I am sometimes with the media, because we consume media, like almost all people consume media now in these little snippets, like little, honestly, like tweets at this point, and we don't ever consider like some of the sort of more complex like issues like homelessness and substance use. Essentially, like what I would suggest is like get involved and get behind people who are the experts in the field. People who are living it every single day are the experts, and make sure elevate their voices. Because if they're living it, they honestly know what's best, and so elevate people's voices. Like honestly, the politicians aren't going to do anything until the public is making a fuss about it. And so things like the overdose crisis and lack of supportive housing is really an issue of the public not being loud enough, because the politicians will only do what the public sort of yells at them to do. So that's a very just very high level and broad, but those are the same questions that all of us on this call are trying to figure out. And so I would say listen to those who are living it, and have lived experience, and are doing it every single day, and elevate their voices.
I was going to say about like a better tent city. It seems to me to be such a creative outside of the box. Well, it's not really. So tent cities are like tiny homes are such a great example of not doing the same thing, because we've still got this one size fits all shelter system, and they do not fit. Like the people I know right now in Hamilton who are sleeping literally outside tonight and survived the weekend. They absolutely adamantly will not go into a shelter. They have some pretty solid reasons for not doing so. They won't even venture in. And I've suggested to our city councilors, I know this is completely outside the box, but what about putting a tiny home in that little parkette where that person is? I read about this city in Germany that has solar powered sleeping pods. And I thought, I love that. I mean, it's just, and they moved them around, and they can actually, so these people that I know, Margaret did that. She had a little parkette in the East End where she liked to park herself, and she stayed there for months. And if you could just keep them safe, mostly at night. So we have to get more creative and allow for, different options.
And we also need to fund appropriately. And so there's tons of great projects out there that are not funded appropriately. They don't have enough money to actually run the programs that they want to run in the way that they know they need to be run, and they don't have enough staff. And so when we talk about these projects, whether it's a better tent city, and a better tent city, let's not forget how a better tent city began. A better tent city was a project that started by people for people. People were living in that space, in that convenience store, and they were hosting each other. And then we jumped in, and now they've gotten where they've gotten because of money. The money is what's getting this done. There was brave people that took that and ran with it, and then they put money into it. And that's what you're seeing develop right now. So there isn't enough money for staffing. There's not enough money for the actual programs. There's not enough money for housing. There's some for a little bit. All of the programs that are running right now are doing really great. There's good numbers. There's good turnouts. That's what they're all telling us. But they're running in small programs, in small pockets, right? So we can continue to do that again, or we can change the system to actually start funding these things appropriately. And let's put that pressure back there, right? Housing is a human right. Housing should not be a commodity that everybody gets to play with in the market. Housing is a human right. So I am not making any judgments. If you are a landlord that owns 45 private condos in the downtown area, good for you. You've put on a lot of work to get there. All I'm saying is housing is a human right. And we're forgetting that. And for some reason, we don't want to challenge that in the higher ups.
Yeah. I'll address that first question. Why was the mental health system dismantled to begin with? I can answer that in a very short response, because they could. I think that obviously, as I mentioned, it was the introduction of this antipsychotic medication that allowed them to start looking at different ways of doing things. And it's the bricks and mortar of the healthcare system that's the biggest cost. And I think that politicians, like, I've really thought about this question a lot. I think they actually might have considered that they were going to follow up with community supports and mental health clinics and outreach workers and all those things that they were going to do. And when they realized they weren't getting away with it, as cynical as that sounds, they just weren't held accountable. And so they just kept moving them out. And unfortunately, homeless people do not have a voice. They often don't vote. And they've often been separated from family or abandoned by family. And so they weren't being held accountable. So it just kept going. And, I've said to people, well, okay, what's wrong with our current system in terms of long-term care homes in the middle of pandemic? So, and we're all like screaming and saying, why don't they do this one? 60 years down the road, they're going to say, why were they treating people like that? Well, because they could get away with it.
How about this question? Someone mentioned that the region used to have motel overflows so that no one should be turned away at a shelter. Is that still the case?
It is in Hamilton. I'll see what Jesse and Sarah say. I know they've opened up more hotel rooms because of it, because of the pandemic.
Sarah's currently working at a shelter. I used to work at a shelter, and I found it frustrating, to say the least. In terms of just how we currently have it set up anyways, where if someone comes in and they ask for a bed and we're full and I put them on the waiting list, I can refer them to another shelter. And if they don't want to travel to a totally different city, because all of their resources, all their connections, their workers there, their medical appointments are there, everything is there. If they don't want to go down to another shelter that they could be, one, restricted from, or two, sort of have some past victimization and trauma from. The list goes on, as the book details and as Denise has mentioned. Then because like there is one open bed in a shelter somewhere, that means those 30 people, because there's that one open bed somewhere, that means, well, the shelter system isn't full. Therefore, we're not going to put anyone in a motel. That was the answer I always got when I wanted to put people in a motel, because that was the logical answer. It was every single night, 30 people come to the door and they can't get in. Then I was hoping I could put all 30 of those people right into motels. But as you can imagine, that is quite expensive cost. And so I'm guessing that's kind of where it comes down to, is our priorities in terms of, we probably have the money, just that, yeah. So that was always like sort of those little nuances that we could not get around.
Yeah.
And I wanted to quickly touch on the out of cold. Sarah was going to probably give more context around why those closed. I came after. I'm a fairly new worker, but I can tell you, I can imagine what those churches must have experienced when they were a group full of volunteers that weren't trained. They were just there with the goodness of their heart. I'm sure, just like me, like I went into the work and I had the exact same mentality. I was shocked when I went into a shelter and I experienced the things I experienced. Sort of the mental health, like, again, I'm talking about like one example of someone who had neglected to look after themselves so much in terms of hygiene that they had maggots living in their legs, eating away at their flesh. To frostbite that has taken away people's fingers, to all these things that you are trying, and all these really, really complicated mental health, schizophrenia that like you don't know what to do with, and substance use, all at the same time. You can imagine the churches became very overwhelmed, and just as I did when I first entered the work. And so I don't think we supported the churches enough. I think we could have probably supported them a lot more, but Sarah can probably give more historical context than I could.
Yeah, and there was lots of conversations in the transfer between, like, when Out of the Cold closed, and connecting with agencies that were actively working with folks who had been staying at the Out of the Cold and using those services. one of the things that we did find out, so outreach workers met with out of the cold folks because they were concerned of, did anybody know the folks that were staying there? So the first concern was eased when we realized that everybody that was at the out of the colds, we actually knew by name. The workers out on the streets knew everybody that was being hosted at the out of the colds. Jesse is 100% right. The drugs that we're seeing in our community right now are changing the game. We've never lived in a moment like this. We've never seen the complexity and the complications that are happening on the streets and with the drug use that is going on right now. And so that's what folks at the out of the cold were experiencing, and lots of great intentions, but there was a lack of training and information. And so they had they had met a threshold. They were doing all that they could do, and it had just reached the limit. And so at this point, the kind thing to do is to involve folks that have experience, that have training, that have some knowledge in mental health illnesses, in the experience of homelessness, drug use, overdoses, acquired brain injuries. Again, the list goes on. And that really is a kindness to the folks that we're supporting, to be able to provide those services and that information to them. And so that was really the big thing that's why Out of the Cold stopped and changed to other things, was just the lack of knowledge and training.
Can I answer a question? How did Margaret lose touch with family members? It's because that speaks to a larger issue as well. It is hard for family to support someone once they have ended up on the streets. Very hard. It's so the people that are homeless in Hamilton that I'm trying to support. There's clearly a mental illness there, clearly. And but there's nothing you can do. And I find as soon as I even mention the word shelter, I start to alienate them. So I just try to hand out hand warmers and Tim Hortons roast beef sandwiches when I can to try to help them, because they don't even leave the spot. Because I mentioned earlier, don't give food. They're stuck in these spots just trying to keep warm. And so I'm trying to take them hot chocolate. But anyways, in Margaret's case, it was more a matter of religion, because the parents actually believed that Margaret wasn't trying hard enough to believe in the Lord, and therefore she was being overcome by these hallucinations and demons, and they just kept saying to her, if you just put more faith in the Lord, you'll get better. And I just can't imagine the pain that must have caused a 19-year-old girl who's already in a large institution with 1,400 people, all by herself. So she was admitted to the HPH at 18, 19, and within 2 years, the whole family moved to the States. They did it because the father got a job down there, but over the next 20, 30 years, they saw Margaret 2 or 3 times. And I have copies of her letters she wrote home saying, so I want to see you so much and I miss you. And her father was very, very, very judgmental and nasty to her. And I think she spent a lot of her time just trying to be the dutiful daughter and win his approval. And it was just sad watching this play out like that. But that's a story that happens. I write about a fellow named Casper in the book, and his sister said, you can't imagine what it's like to go down the main street of Hamilton and see your brother sitting there in the winter without a coat on. And not be able to do anything. So the family members really struggle with this as well. It's a tragedy for them as well.
So a couple more questions, so we'll try to get to a couple more. I wondered if Jesse and Sarah, you could talk about how you build a network of support around a person experiencing homelessness, or what that looks like in the region, and also about support for the people that work with individuals experiencing homelessness.
I would say this is a good plug for Sarah to talk about her latest project, because there definitely has been a huge growing need for sort of frontline workers to get to have a place for them to share and connect and feel validated. As someone that got to learn from Sarah and as someone new into the work, it is a really sad thing because it's these are human services that we're talking about. And so therefore, the longer a worker stays, and I'm sure Denise saw this at sort of different drop-ins, the longer workers stay in the field, the more valuable they become into the community. And so what we're seeing is such a huge high turnover rate in this field, and no one can stay in it for very long just because of the sheer amount of death. And we used to call it sort of vicarious trauma, but now it's direct trauma to staff members. And so I know there's a lot of good workers out there who want to organize and have been in small ways in terms of creating a sort of a community-based network and support for frontline workers. Just as we're going through, again, like in Canada, for example, we're losing about 20 people a day to overdoses. Like 20 people, that's almost 1 an hour. Like in a in a country like Canada, that's wild. And so we are in like one of the sort of craziest unspoken crisis of our time, and no one is really bringing it. Like it's not like, you know, making the headlines like it does COVID every single day. But anyways. But in terms of like, better communication and partnership between staff at hospitals and workers like Sarah and I, definitely, like, again, more of that would be needed and would be welcomed. I know we just need more, honestly, sort of psychiatric nurses just in general, because talking with one nurse, she told me that we have Denise mentioned a few times in the book, like sort of these supportive networks of care teams that would wrap around someone like Margaret. And honestly, we only have about, like, again, we kind of, with 1,000 people experiencing homelessness, 70% having mental health issues. Only 50 people have a psychiatric team that actually follow them, make sure that they get their injections, their medications, that they're actually being watched and supported while they're out in the community, not even because they have a hospital bed. Freeport only has, like, I think 50 beds for mental health. And 50 people are only being followed for psychiatric care outside of the hospital. And so, like, that alone, we know that there's way more than 50 people out in our community. Like, I can walk down the shelter just right now and I could point out many people that need way more support than they do, purely on the psychiatric parts, let alone all these other, there's all these other conditions that people are either diagnosed with or still undiagnosed. And so, yes, there needs to be way more collaboration, because that right now there's only a few workers that actually stay in contact with hospital workers. And like, honestly, as a worker myself that tries to support sort of 100 people who are sleeping outside in Cambridge, I'm not even connected to the hospital. I don't even have a worker I can call up to be like, hey, so-and-so. Like, I just call community nurses that are already stretched thin as it is. I can't understate how overwhelming the problem is, and no one really knows about it.
I would say just a couple of words to keep in your head when doing the work and trying to connect with others while doing the work is ego. Check your ego, put it aside, put it at the front door, just leave it. It has nothing to do with the next things that you're about to do and the work and the human connections you're about to make. And those human connections with the people that you're supporting, but also those other staff, the nurses at the hospital, the social workers, the outreach workers that you're going to run into, the admin folks that you're going to see at the front desks. I think part of what we forget, and it's not that we maybe forget, it's just that we become exhausted. It's an exhausting kind of work. And so you save your energy for the folks that you're going to be supporting, the ones that are your quote unquote clients. And we forget to be kind with each other and to give each other the grace of just time and thought and space. And so I know that I've had the privilege, and I realize now that it was a humongous privilege to be able to have folks that I got to watch do the work and learn from, who led with their heart. Intelligent, academically intelligent people with all sorts of degrees, but they still led with their hearts. They understood that you had to make this human connection if you stood any kind of chance to understand the complexities that this person was living with, whether it was their mental health or addictions, or trying to maneuver in a system that was not designed in any kind way. And so I think that allow yourself to ask lots of questions. Even if it seems silly, allow yourself to ask those questions. Become the know-all of like all the random little things that nobody else seems to know. Ask all those questions, put all that stuff in your head, and connect with other workers. Check in with each other. When you're feeling tired, allow yourself to just say that. I'm tired, I'm hurting, I am sad. We're asking you guys to go out and connect with people in real ways, which means that at death, that's a loss. That's a loss of a friend. So you can allow yourself that space, that kindness, and then reach out and talk, debrief, vent, have a safe person. Vicki Reynolds is a name that I'm gonna throw out there. If you're actively doing the work right now, or you're somebody that supervises frontline workers, you need to look up Vicki Reynolds. And Vicki Reynolds, we're hosting her, pitch. We're actually gonna host an online conversation with Vicki Reynolds and Peregrine Outreach on February 6th. And so also really important. And she's challenging language. So it's not just vicarious trauma anymore, it's spiritual pain. And let's talk about that. Let's not be scared about what that means. Let's really dig into that so that we can actually stay doing this work.
I remember when I was covering social services at the SPEC for many years, they called it compassion fatigue. And you'd hear about it very often among, for example, Children's Aid Society workers, because they're seeing neglected, abused children. And but I think you're right, like especially what Jesse was saying, like it's now at a whole other level with all these fentanyl deaths and just these people. Like I said, the two people I'm trying to support who are literally living outside right now, it's absolutely heartbreaking. I think about them before I fall asleep, and they're on my mind when I wake up. And I'm like, did they make it through the night? How fast can I get in and get them some hot chocolate or see it? Like, because every day I drive in, I think they might not be alive.
And what
so you guys work with that?
And what university or college course is preparing social
Right.
workers, MSWs, social service workers to go out there and deal with somebody's death on the first and second day?
Right.
If you're working at a shelter, it is a reality.
Yeah.
And it's a reality that people are stepping into completely unprepared.
Yeah. Francine Small talked about that in my book. And then Margaret was the one who taught her the lesson about, like, you're too sensitive to work here. You need to go somewhere else. And she realized she was, but she never forgot that lesson.
Okay. Last question, if you can quickly answer. Are there addicts that want to quit, or is drug use part of some people's lives?
That's it's a good question. First thing I'll maybe say, I'm not sure if the person's on the call. Mind you, it's amazing that 53 people have stuck around. Thank you so much for sticking around this long. That's incredible. I would be hesitant with that language, obviously, like someone who uses substances, does any of them want to quit? I would say from all of my conversations with people, the answer would be yes. A lot of them have that same goal. It seems to be the same goal as sometimes the public. A good portion of them do absolutely want to get off of substances. Again, we got to look at it as not like the first thing we got to do is get them to stop taking substances. No, it's looking at all the things, the reasons why they're taking it. There's real pain there, and there's real trauma, and there's real mental health and physical health that they are trying to self-medicate. So we need to tackle that, and we need to treat them with an insane amount of compassion, and focus on sort of, for a lot of people, substance use is actually their solution to their problem. So yes, a lot of people don't want to get rid of their substance use, but but right now it's their solution to their problem. And so we need to help them fix their problem, which is housing, which is all these other pieces that we've talked about all night long. And mind you, and I'll also say though, that there's a large chunk of people who use substances that will probably maybe forever use substances, and they might choose to keep using substances. And just like how I choose to use substances every single day, like coffee or alcohol or anything else, like that they have the right to do that, and they have a right to make it safe. And we are failing people right now because we have no safe option for people. They are forced to use an unregulated market that is killing them. And that I could go on longer rants, but if you want to know more, like watch something like Rat Park, it's a documentary, or just look up the war on drugs on YouTube. And there's an insane amount of evidence out there right now that we are failing people with our current drug policy, and it needs to change. And again, that's just like how we were talking about before around the housing advocacy, drug policy. Honestly, we need to start listening to people who are actually living it every single day, and listen to people who use drugs before we listen to our politicians about how to solve this problem. And they'll be the first ones to tell you that yes, they would love to quit, but and they know how to quit. And so we should start listening to them rather than just us imposing things onto people.
I always find it interesting that we're making policies about drug use with people that have never used those drugs themselves, right? Or at least openly not sharing that they've used those drugs themselves. And so, you know, it's one of the few places that we allow that to happen, right? And where we're demanding numbers that we want to read as successful. The jail system has repeatedly told us year in and year out that they need more jails. Does that mean they're not working? I mean, to me, that means that they're not working, correct? Is it the goal of jails not to like have people come back? And yet they keep telling us they need more money for more jails, and here we go, we give them more money. It's one of the few programs that, and police, they're the only programs that they can actually hand numbers over, prove to us that it's not working, and we will hand them more money. Right? I mean, and think whatever you want out of that, but it's one of those funding pieces that really confuse me.
If I would just say, if we talk about drug use, it's the high drug abuse among homeless people, I think, just speaks to the brutalities of their lives and their need to self-medicate, because it's just, you know, I know there was a city councilor in Hamilton who accused this doctors outreach group of artificially inflating the number of homeless people because this outreach group gave people tents. And I talked to the city councilor. I said, do you think they're camping? Like, do you think they're not having fun? They're not out with like barbecuing hot dogs and like what? Like that's a brutal life. That's like third world squalor. You know, I've been to the tandem cabins. That's not an option. That's what they've ended up doing because they've run out of options. There's nothing left. And you know, we got this, like I said, one size fits all shelter system that, you know, everybody lined up in rows and bunk beds and they're just crowded in there. And, you know, we have to start getting more creative. And like I said, think outside of the box. And, you know, so many times it's like, let's talk to the people. Talk to the people. What do they want?
Yeah, I like Denise, like I absolutely, I couldn't agree more, where like anyone who's still left on this call, I would encourage you to go and like sort of go talk to people, because I didn't believe in any of this. I like 3 years ago, I had a totally different mindset and I did not know what the solutions were. I just guessed, and I was only fed what I was sort of told and sort of in mainstream media as to what's going on, and I didn't really have any understanding of the problem, and I thought I knew the solutions. But like, if you go up and start to talk to people and hear their stories, you'll quickly realize like, oh, people don't necessarily want to be in this situation at all, and they have the same goals I do. So then, what's the problem? If we all have the same goals, then like, why isn't anything like better? And it's honestly like the glass ceiling that we've hit right now is just at the decision-making table. We have loads of evidence, like an insane amount, and evidence, as you talked about earlier, about not just not just like for humanizing the problem, but also just purely if someone who just absolutely hates someone who's homeless and hates all of it, that like they would also be quite shocked to realize how much money that we're wasting. That could be better utilized if we just house people rather than manage it. I think people I think that's honestly the sad reality is that's how we're going to win sort of over the politicians and the general public, is if we make this about a numbers game, and we have to almost dehumanize it by just being like, hey, this costs you a lot of money. Like, you'd probably like a better solution like that has been presented tonight in other countries and other cities done it.
Well, in fact, the mayor of Medicine Hat, Ted Clugston, openly admits, and he sort of sheepishly, that his reasons for agreeing with the plan, because staff presented it to him, like, here's why we're going to end homelessness, were totally economic. He said, I looked at that like, oh my God, it's costing us $100,000 to keep one person on the street, and we can house them for 24,000. He said he wasn't even a humanitarian. Now it is. Now he understands people's lives and just what they're going through. But so if it's just for that reason alone, then we have to start making changes.
Okay, I think we are well over our time now. Our last question here was to share something positive, and I hope that you will take that that step and reach out to people in your community instead of just walking by. Any final words from the three of you?
I mean, one thing you can say is at least the pandemic has raised the profile of homelessness. It is in the news now. It's getting more attention. It's more visible, which is angering the local politicians, but it was more visible with tent encampments. But it is definitely, I mean, it's a story in our local paper every day. There's a story on it. It's not just because it's winter, it's the pandemic. So my hope is that, it's not a great reason that you want it to be elevated, but because of the pandemic, but if it is, then let's work together and try to find a solution. So I do believe like even one individual could do something. Like I'm trying to bring our mayor together with the mayor of Medicine Hat and just use that as sort of an entry point.
Okay. Yeah. Any final words, Jesse or Sarah?
I was just going to say, like, I've during the pandemic, like a bunch of sort of groups of volunteers have gotten together, and there's been lots of advocacy groups that have been formed, and lots of sort of really cool, so like networks of volunteers, and we honestly, we are so appreciative of it, and like I want everyone on the call to realize like they have a lot of power. Like they have a lot of power. I don't think people realize how much power they have. And sadly, the folks that we seem to serve every single day, they also have power, but I think that their voices are a lot quicker to be dismissed and silenced. And so just raise up those voices and just sort of pitch in and help sort of groups that are already doing it. You don't even have to reinvent the wheel. Right. The evidence is already out there. The advocacy groups are already out there. You just need to help them by just like gaining in numbers and so yeah, like the work's already being done. It's been done for a long time, and it will continue to be done. But yeah, sort of don't be afraid to jump in and ask questions and reach out about how you can get more involved. Yeah, and thanks so much for just coming out. That's my last thing. Just say thank you.
Thank you, everybody.
Yeah, and please read the book.
Thanks,
really quick for me, how many people attended tonight? Especially being like Zoom, and I wish we could have all been in the same room together. The exchange, lively, have that energy. Love to do that. Hopefully after the pandemic. I think for me, honestly, the last thing I would say is this is something that somebody shared with me, a youth shared with me 15 years ago. And he said, if anybody's ever asking for advice as to how to connect with someone that's panhandling, don't ignore them. Make eye contact. Look at the person. If you can make eye contact, eye contact, and then just simply apologize if you don't have any. Just give a nod, but the eye contact reminds them that they're human and they're still being seen. That is who we all are, and we all still need that humanity in us. And so, and that is something very simple that we can all do. You don't have to be a professional about mental health illnesses or poverty or homelessness. You can do that on the bus. Don't shy away from the person that you think may look disheveled and you don't want to sit next to on the bus. Sit next to that person on the bus. Don't allow what you see in the image to be scary. Allow yourself to see the humanity in that person.
Okay, well, with that, I think that's a great ending point for us. Thank you so much, Denise, for a fabulous book, Jesse and Sarah for your expertise and hard work, and for everyone attending tonight for some great questions and your attentive nature for the evening. I hope that you'll join us for more programs in the future, and have a great night, everyone. Great. Thank you very much.
Thank you so much. Thank you. Thanks everybody for coming. Appreciate it.